infectious diseases expert, joins us now. Very good evening to you, and thank you so much for speaking to us.
Good evening, and thank you for your interest.
What is most intriguing for you in this new discovery, and what we're coming to learn about COVID-19?
Scientifically, I think it's fantastic, the work that has been done by our laboratory colleagues from the CRISP Institute, led by Tullio de Oliveira. I think that the really important findings are that this virus is evolving. We're seeing a new strain. This evolution does, in fact, impact significantly on the viral replication. So the viral load is actually much higher in these patients, as seen by the CT values. That causes us to be very concerned about the transmission, that in fact transmission may be increased. This may be explaining the significant increase in the number of cases that we're seeing, and the second wave has actually come earlier than we anticipated. During the presentation by Professor Karim, we actually saw that in fact the case rates are rising in all the provinces now, although most measured in the Western Cape, Eastern Cape, but we're very concerned about KwaZulu-Natal and Gauteng province. But it actually is rising in all 9 provinces. So we have seen changes in the virus that affect the binding site of the host at the ACE receptor, ACE2 receptor. We are seeing changes within the binding domain that actually may be affected by antibodies that have been generated. We do not know as yet whether this is a milder form of disease or will cause a milder form of disease or not. We also do not know the impact on the vaccines that we are studying within South Africa and around the world.
Okay, before we get to the vaccines, I want to understand what this exactly means, that the mutations that have been seen so far seem to be evolutionary neutral rather than as a result of viral adaptation.
So I do think that it is in the nature of viruses to evolve over time. It is in their nature to increase their replication. It does, in fact, demonstrate, because this is the dominant strain now that is circulating, does demonstrate that this virus is more transmissible. And I think that the intention of the virus is to sustain itself. If it became weaker and less transmissible, then essentially it would die out within the host, which in this instance is the people, the population. And so it is an evolution. It's not a new type of virus. It is a variant, so-called 501v2 variant of the virus. It is, however, leading to what concerns me is the very rapid rise in case rates around the country. We think that we need to treat it the same way. We need to prevent it the same way, which is through the social distancing and masking and hand sanitizing. And the minister emphasized ventilation in closed spaces. We need to continue with the social distancing interventions announced by the president. And I think that it's really, really key that we adhere to those, and that we say to those people who wish this virus away through fake news that it is really time to stop the disinformation and to accept that the case rates are rising in the second wave.
So let's understand this, because the warning obviously is now more urgent than ever to really try and stay away from crowded environments. Is the virus forced to evolve because more people have it? So the more we expose each other, does it then mean that there'll be more variants of it because of that? And also, you're speaking about vaccines earlier on. The spike protein was mentioned earlier on. Does that mean when we're looking at vaccines, it would be a protein-based solution?
So no, I think that we can only speculate at the moment the impact on vaccines. Those studies will be done. The new virus will be tested against serum from patients that have been participants that have been inoculated, and we'll look at the neutralizing effect of that. And those studies are underway within the NICD and the CRISP Institute. And the actual vaccine manufacturers are super interested in all the variants and are testing these variants against their banks of sera. So we don't know as yet is I think the answer. We will know very soon because this is clearly a high priority question. We are seeing variants in various places around the world. The UK has also identified a novel variant. It is not the same as the variant that has been identified in South Africa. But the nature of these is that the case rates are going up and the admission rates are going up. We therefore need to prepare the health system, and we really do need to ask the society to practice the distancing and sanitizing and masking interventions to reduce the spread, because at this time, the hospitals, particularly private hospitals, are full, and the public hospitals tend to follow within a couple of weeks of the private hospitals. So we are I personally am very worried for the health system, and I'm very worried for the people who become ill in the next couple of weeks.
And in light of that, I read a very interesting research from the University of Queensland, I think. They said that those who were volunteers for the vaccination program, that some of them came back with false HIV positive results as a result of, I think, the HIV or molecular clamp that's derived from the protein of HIV. Have we seen anything of that here in South Africa?
So we saw that news, and although HIV is my primary interest, we have not been able to confirm any of those suspicions. At this time, we will be looking out for it. I think it's very early days to answer that question.
All right, thank you so much for speaking to us, sharing your insights, Professor Sanne, who is infectious diseases expert. We'll be back right after the break as you